dark spots and everything, then definitely the patient is a glaucomatous patient. Because there is another terminology in which the eye pressure is raised, in which the corneal thickness is more, that is called as ocular hypertension.
Sir, what is the time duration a diabetic person needs to check his eyes
Yeah.
numbers, please?
Once the patient has been substantiated as diabetes, first visit should be immediately. Once immediate visit is there is documentation that okay, the retina and everything is absolutely under normal limits. Now, next visit, as per what is the status of the diabetes, if it is more, for example, more than 200 or something, then after 6 months the visit should be there. Then again,
Every 6 months we need.
every 6 months one should pay a visit to the doctor.
Thank you so much, Dr. Chatterjee. Your talk has been very informative, and I'm sure it will help all the people who are present here,
Thank you.
who are even non-medical. Acha, my question is, see, in diabetes, diabetes is a disease which affects all the system of the body. So, is there a special correlation between kidney complications of diabetes and eye complications?
No, there is no specific correlation, but anybody who is having a diabetic nephropathy definitely will have some sort of diabetic retinopathy.
Yeah, so,
definitely.
yeah.
That's why the eye is called as a window to the human body. Any diseases across the body, it is reflected in the eye.
Okay, thank you so much.
Welcome.
Hello, I am 79.
Yes, sir.
When to doubt I am getting cataract. At present I am able to read nicely, no problem. But I am getting a doubt when to doubt that I have got a cataract.
So once you feel that while walking across the street or while reading the newspaper, you are not able to perceive the vision with as clarity as you were able to perceive, then definitely you should pay a visit. But there is no as such statistics or calculation that at this age you will get cataract or not.
Yeah, earlier it was considered that when the patient gets when the cataract gets mature, then only you should operate. I mean, what
No,
is the ideal time? Is it, is
no,
it
no,
so
no,
really
no,
followed
no,
these
no.
days, or
No, not at all.
then what is the stage at which you start
sh-
operating on a patient? I mean,
The ideal stage is that as soon as you develop cataract,
Yeah.
for example, we take the vision. If the vision is around 6, 9 and all, you should get it operated. Why? Because we do these days, which is called, as I said, phacoemulsification surgery. So it's a machine. It has its own capability and it has its own power. So if as the cataract becomes hard, how much money you invest?
It's difficult.
But it is the machine which breaks the cataract and eats it up. The machine doesn't able to break it. We try to break it more with using more power, then the complications takes place.
so you mean to
So
say it's better
it
if
is
we
better to
operate
get early.
rather
Earlier
than
the
waiting.
surgery is done, easier for the patient recovery, easier for the surgeon, and patient is able to see also clearly at a more earlier stage.
And sometimes after operation or after surgery, I mean, after 3-4 years maybe, patient develops some, decrease in vision or
Yeah.
something.
Yes.
I mean, are there any options available? I mean, do you give laser and all? Or
Yes.
what
Nay,
actually you...
Anybody, whomever we operate or whatever lens we put in the eye, today or tomorrow, they will develop a haziness in vision.
Yeah.
The purpose is that because when we put the lens, we are injecting it in a bag, which is called a posterior capsular bag. Once we inject the lens in the bag, a friction takes place between the bag and the lens, which leads to develop, with the help of meiosis, a new structure develops with spider web-like appearance. So these things patient will develop, but nothing to worry as such, because that thing can be taken care by laser and it's a 5 to 10 minutes job.
Okay, thank you. Thank you so much.
Is there any more queries for sir? Thank you, Dr. Chatterjee, for such an informative session. I would like to call on Dr. Kalyani Sen, Medical Superintendent of MGM Hospital, Vashi, to kindly felicitate Dr. Chatterjee. Thank you, ma'am. Thank you, sir. I would now just briefly remind all the audience, kindly deposit your feedback forms with our Ms. Prishali. There is the health checkup camp which is going on. All those who have not conducted it tomorrow or yesterday, you can do it today. They will guide you for it. And we are again reminding you for rejoining us tomorrow for the educative sessions, which is again at 10:30 in the morning till 12:30. I thank one and all for gracing this occasion by your presence. Thank you, sir. Thank you, ma'am. Thank you.